Is brought to you by AVERA.
Tonight, we are following up on a patient who had rotator cuff surgery in mid-August at the AVERA Surgery Center. KSFY's Naeve Brown checks in with her at CORE's Orthopedics Physical Therapy Clinic to see how recovery and rehab is going.
Renee Coley from Sioux Falls is on her 7th week of rehabilitation on her right shoulder with physical therapist Johannsen at Core Orthopedics AVERA Medical Group. She starts her sessions with a warm-up on the arm bike. We were there to watch in August as Core surgeon Dr. Erik Peterson repaired her right torn rotator cuff arthroscopically. It's a less invasive procedure that uses special equipment and small incisions. She also had cartilage damage, so he cleaned that up and removed some bone spurs.
Well, it was tough the first 6 weeks. I slept in a recliner, and then finally my husband said, "Don't you think you should go back to bed?"
Renee started physical therapy just a week after post-op.
The main reason is to slow down the stiffness and the lack of mobility that develops in the shoulder as a healing process is going on. The shoulder does tend to get stiff, so we try to slow that down.
For 6 weeks, Renee wore this sling pretty much everywhere she went. But just last week, she got it off, and she was kind of happy to lose it.
Well, I can do about that I'm trying to get up there, but I can't yet. Yeah.
Up until now, Renee was not supposed to use her right arm at all. But now that she's reached the 7-week mark and the sling is off, Jill will work more on range of motion.
For the most part, we're starting to work on getting the patient to do a little bit more at home, assisting their shoulder in the range of motion with pulleys. We use a cane or a stick a lot to have the patient with their other arm assist that shoulder out and away from their body and in all different ranges of motion.
Even though Renee has had a little bit of pain during her recovery, she said she got immediate relief in her neck post-surgery.
I couldn't sleep.
Couldn't move your head.
I know, and that was wonderful. When I woke up, no more headaches. My neck didn't hurt.
Rehab is a slow process because no matter what, progress never comes fast enough. For Renee, she is happy to have the surgery on her shoulder behind her and looks forward to what's ahead. She knows with continued hard work, it will undoubtedly be her arm above her head. With your AVERA Medical Minute, I'm Naeve Brown, KSFY News.
And Renee goes to physical therapy twice a week and does arm exercises at home daily. For more information, you can call 877-AVERA or visit ksfy.com and click on Health.